Where can you find bladder nerve stimulation treatment? If you are wondering where to find bladder nerve stimulation treatment, you are not alone. Many people seek options for managing bladder control issues, especially overactive bladder symptoms. Bladder nerve stimulation treatments are available in specialized urology and urogynecology clinics. These clinics are often part of hospital systems or dedicated outpatient centers, making them accessible to many patients. Two main types of nerve stimulation therapies are commonly offered: percutaneous tibial nerve stimulation and sacral neuromodulation. Let's dive into each of these treatments. Percutaneous tibial nerve stimulation, often referred to as PTNS, is a minimally invasive procedure. During PTNS, a small needle electrode is inserted near the tibial nerve at the ankle. This electrode sends mild electrical impulses that stimulate the sacral nerves, which control bladder function. The procedure is typically done in an office setting and usually requires a series of 12 weekly sessions. Each session lasts about 30 minutes. After the initial treatment, periodic maintenance sessions may be necessary. PTNS is widely available at many urology clinics, including those within the Mayo Clinic health system and specialized women's health clinics. Patients often find this treatment virtually pain-free, and it does not require surgery or anesthesia. On the other hand, sacral neuromodulation is a more invasive option. This treatment involves surgically implanting a device that directly stimulates the sacral nerves located near the tailbone. Sacral neuromodulation requires general anesthesia and is typically performed in 2 stages. Patients will need ongoing follow-up care to monitor the device. While this treatment has stronger long-term evidence for effectiveness compared to PTNS, it is more complex and requires lifelong management of the implanted device. Both PTNS and sacral neuromodulation are intended for patients dealing with bladder control issues such as overactive bladder, urinary frequency, urgency, and incontinence. These treatments may be considered when conservative methods have not provided sufficient relief. For individuals with bladder cancer, nerve stimulation treatments may help manage bladder dysfunction symptoms. However, it is crucial to consult with a healthcare provider who specializes in bladder health. Each patient's treatment needs can vary significantly, so personalized evaluation is essential. In summary, bladder nerve stimulation treatments like PTNS and sacral neuromodulation can be found at urology and urogynecology clinics, often within hospital outpatient departments or specialized health centers. Access to these treatments depends on local healthcare resources, and it is always best to consult a healthcare professional experienced in bladder health and bladder cancer management. This way, you can determine the most suitable therapy based on your individual medical conditions and treatment goals.